There is general agreement that if a healthy person, and I would like to stress the word healthy, a healthy person, and if it's a man, has 2 drinks per day, and a woman has 1 drink per day, this is acceptable. It's not completely without risk, but it's acceptable. What does that mean in gram of alcohol? That means we can discuss between 12 and 14 grams of alcohol for a woman, and about double it, 25 grams of alcohol for a man. How much is that? That's about 200 to 250 milliliters of wine for a man and half of that of a woman. Why is the recommendation level to be on the safe side for women less than for men? Because women are more susceptible and sensible. Nobody knows the answer for that. Many laboratories, including ours, have studied that for quite a while. Probably one factor are estrogens. Estrogens will be increased by alcohol, and they may have a negative input on the liver, but also on breast cancer. And it's not widely known that chronic alcohol drinking is a risk factor for breast cancer. And this is our major concern, because this already occurs at lower levels. If you have some disease, and this may include hypertension, for example, or fat metabolism disturbances, and many, you name it, then you have to be more careful with the chronic intake of alcohol. One aspect is, at present, the detection of DNA lesions in various tissues, including breast tissues, because not much study has been done with that, what I earlier mentioned, with the risk for breast cancer. And we could detect DNA lesions similar to that in liver in breast tissue. This is a very exciting study where it's just ongoing. We have another study on colon, which is also a target for alcohol. We were the first looking at non-invasive liver tests for fibrosis. This is the so-called transient elastography, and this is probably, we started that in 2007, and it came from Swiss cheese industry. They put a share wave, a sonographic wave into the cheese, and they could detect the speed, the velocity of that wave. And as faster the wave goes through, as harder the cheese is. And then they transferred it to the liver. Let's say for a moment the liver is like cheese. So you put a share wave from outside into the liver, measure the velocity, and the velocity correlates very, very nicely with the stiffness of the liver. And as stiffer the liver is, as more fibrotic tissue is in the liver. So this is a method to measure fibrosis and cirrhosis. Now we have a similar system for rodents, for animal experiments, with a little FibroScan, and we can modulate what determines the stiffness. It's not only the fibrosis, it's the fluid in the liver, it's the portal pressure, it's the arterial pressure, so we will find out what is going on with respect to that aspect. We heard Dr. Pietrangelo this morning, a fantastic lecture on iron and the liver, and we are doing similar things with hepcidin, with a little hormone of the liver, and looking what it is hepcidin doing, how is it expressed, what are the factors. Alcohol and iron belong together, because iron decreases alcohol decreases hepcidin, and therefore brings iron into the liver, and iron in the liver is very toxic. So iron in the liver leads to radical formation, increases cancer generation, and so on. So there are not many drugs on the market, and they are not so convincing. Now there is a new drug which decreases the craving. These people have craving. This has nothing to do with the liver. They have craving and drink a lot. So with that drug you can decrease craving. When you decrease craving, they still drink, but they drink less. And when they drink less, the liver will be better. The drug is called nalmefene, and this is a study which is going on, and see if we can improve liver function, liver morphology with that drug. But this is an ongoing study. Baclofen is another possibility. We have naltrexone, we have acamprosate, we have baclofen, and we have nalmethane. So these are the four drugs. Some of them are on the market, in some countries, not in every country. But you can imagine that it's a major achievement if you bring people not only with interviews and talking therapy, but also with the support of a drug to drink less. That's very important. Unfortunately, alcoholic liver disease is not represented very well. It's improving. In the last year it was very little. We have initiated an EASL, ESBRA. ESBRA is the European Society for Biomedical Research on Alcoholism, where I was the president. We have installed an EASL-ESBRA joint symposium every year since 5 years. It was not the case this year, but it will be certainly, I hope so, next year. And this brings the alcohol researcher closer together, because now hepatitis C and B has been more or less settled. I think open questions are still on the #1 liver disease in Europe. This is alcoholic liver disease. This is #1 liver disease in Europe. And of course, non-alcoholic fatty liver disease, as you probably know. In the United States, it's #1. In Europe, it's increasing. So these are 2 liver diseases for the future, which will draw our attention to.